Hey guys, my name is Pritish Sahu. I'm currently a internal medicine PGY2. So I'm done with my intern year, and throughout the year, I kind of accumulated a bunch of dot phrases that I one made on my own, or I copied from others, or a combination of both. And I figured that I will share these dot phrases for anyone that it would come to help. It takes a while to go through all these plans, so it definitely makes it easier if it's already kind of in front of you and you could edit it to your liking, or you could just use it outright. I will drop my email in the description box below if you want a copy of this Word document. So starting off with some ACS meds here. So you got Fonda, you got ticagrelor, you got aspirin, you got atorvastatin, that's synapryl beta blocker. So these are all the ACS medications that you would want to use. Again, these are all from up to date. Here I got a little ACS plan here, and here's STEMI or a new bundle branch block or NSTEMI, and I kind of just have some assessment here too in terms of the troponin and the chest X-ray, EKG was showing what results. I got some calculations here. So you got your grades, Timmy, heart score, all the scoring stuff, and what it means in terms of a Timmy 0 to 2. Is it low risk, intermediate risk, high risk, those kind of stuff. And I got the plan here also. So what you want to do if you're thinking that this is an ACS patient. Okay, so kind of go through that. Next, I got a assessment and plan for asthma exacerbation. You will often see this in the clinic, also in the inpatient services. So I got a little assessment here and a plan here, so you can go through that. Alcohol withdrawal. I don't know about your hospital, but we have a lot of alcohol withdrawal patients, and our go-to is the CWA protocol with Ativan PRN. There's some other ways to go about it too, but this is our most common stuff, and this is what you would want to do possibly for a alcohol withdrawal plan. Got a brief back exam here. I do see a lot of MSK patients in the clinic, so you can kind of go with that. Got a chronic low back pain assessment and plan here. Got a back pain differential diagnosis, back pain plan. As you can see, I see a lot of back pain. Back pain red flags for what I think the conservative management may not be enough, and I need imaging or referral to maybe surgery or orthopedics or neurosurgery, something like that. Okay, here's some treatment options. So this is a little bit more conservative. Some medications here. So you obviously got NSAIDs here. And then you got some second line medication like gabapentin, right, duloxetine, that kind of stuff. This is a bowel prep for a possible colonoscopy, so the plan for that. Cellulitis, this is a little bit more extensive. This is not just a dot phrase for your assessment plan, but it also has like almost a overview of what you want to consider for a cellulitis patient. Actually, I mostly derived this from my own presentation that I did during Noon conference. So obviously, you want to have the Lernick score to assess for an STI, and if you want to call surgery or not. I got some things about what an STI would look like. I spelled absence wrong here, by the way. Uh, and if you get a call from the ED, these are some of the things that you want to look at if you want to maybe consider them admitting for inpatient therapy. Some red flag conditions here, the duration, if this is in the clinic, some medication that you may want to consider for outpatient treatment versus inpatient treatment here, with and without MRSA risk. And if there's severely septic, what do you want to do? I got some differential diagnosis here and how it presents. Again, this is from my presentation. So you can kind of pick and choose, and you may want to add this to your note, your H&P, and sound all smart. Some possible causes for cellulitis, and so on and so forth. All right, next I got some chest pain history. This is kind of like HPI thing, the things that you may want to ask. And I got a little score here. You got the ASVD and the MESA score. Next, this is a very, very common internal medicine problem, CHF exacerbation, and what do you want to do? So this is kind of like a plan that you can literally just copy paste and kind of go off of. So obviously you want to look at the diuretic dose that they're on at home, and ideally you want to double it or 2.5 it, the home dose, so that you can diurese them more. Got a little constipation plan here. COPD exacerbation, again, this is a very, very common internal medicine problem to have. How would you treat them? And again, most of these are from up to date. Okay. And COPD subjective, little HPI here, like, what do you want to ask them? Got a costochondritis plan. Again, this is a very common problem that we have in the clinic, because I do see a fair amount of younger patients in the internal medicine clinic. I know it's ironic. And little plan here for that. Some chest pain differential diagnosis. Got a death discharge template here for your discharge summary when a patient dies or passes away. This is alcohol withdrawal. This is I probably got this one from somebody else, but I also have this one here. Maybe you can combine the previous one and this one, or you can just use this one, whatever you like to do. This is a community-acquired pneumonia plan. This is also quite common, so you want to kind of go through here. This is asthma, HPI. Okay, HPI for new asthma concerns. Pancreatitis plan here. Just of note here, this is the aggressive hydration therapy. This was kind of done in the past more, not so much done nowadays. Now we're much more conservative with the fluid resuscitation. We do much lower boluses and the maintenance drip. I just left it here if I think the patient is severely hypovolemic because they've been vomiting for the last many days or weeks or whatever, and I think that they would benefit with the fluid resuscitation. Just be mindful that if patients have history of CHF, then you don't want to give them too much fluids, because then it will just cause pulmonary edema. But so I just left it here, but nowadays it's not really done as much anymore. Nowadays the modern thing to do is just a waterfall trial, and they kind of do the 10 ml per kg bolus and then the 1.5 kg per hour. That's the go-to nowadays. But I just left it here just so you kind of know about it. Okay, I got little scores here, Ranson score, the little diagnostic criteria here. So look at that. Okay, I got a little SBO plan here. SBO is small bowel obstruction. And that's pretty much all that I got here. Again, these are not all the dot phrase that I have, but I kind of just went through my library of dot phrase and just saw which ones will be useful to a new intern or to a resident, and maybe they can kind of learn something from this, or they can use some of this so that they don't have to start from scratch. Again, a lot of this I got from up to date from others. Some of them I made on my own, and I just kind of combined things also. So hopefully this is useful. If you need this in a Word document so that you can copy paste it, just email me. I'll have the email in the description box below. And all the best. You guys got this.